Hello everyone, I'm Elisa Anlaki Buling, 28912. So we are from Group 10, that is Strategy for Cost Optimization and Ensuring Affordable Healthcare Solutions. So there are four members supposed to be, but we have three. That's my name. And then we got on the girls, that is Nurul Namila binti Abdul Aziz, 288726, and Nur Shuhada binti Muhammad Rosri, 288021. So I will start my part first, that is first method, patient empowerment. There are five sub part here, that is enhancing patient education and engagement, promoting self-care practices, strengthening communication and clinicians, leveraging technology and data, and implementing feedback loops. So I start at entrenching patient solutions. In this part here, we have a very main for pregnancy monitoring patients to see condition or not, whether it's like happens some diseases or any some like injuries either here, yeah. For those that are mostly using like mobile apps and educational sessions, like with some like more like more accurate, yeah. So those are the solutions can help to manage chronic diseases and reducing hospitalization and complications in like in short time actually. So the patients now can no need to be worried about this with using like the current technology now, because this will help for informative for fully in like we can find the solution actually. Up next, we go to strengthening communication with clinicians. So in this part here, there are three ways actually. There's clear two-way communication with between us, the patients, and the care providers here. And then you got shared decision makings and personalized care plans. Those these solutions here help to align with patient well and goals. I mean like missions or some like that help patient get better from health issues like diseases, and also improving satisfaction and adherence, which means uh, this will help to the patient to see whether the condition is good or not. If you good, they will the patient will be satisfied with this one. Next, leveraging technology and data. So there are two means like using here like wearable health devices and patient portals. So these two help to track individuals' health data, which means they monitoring any like data of the all individual health, whether it's condition good or not, and like the disease or not, injury or not. Collaborate with providers, support preventive care, which means this is a one of those how the condition is. We can such condition if the issue here, they contact with the care here, and then to have catch potential health issue early, which means this will help to avoid any like issue condition is getting worse actually. But with this technology one, they help to boost the time with the avoiding any like diseases or something. And last but not least, this can reduce expensive treatments as well. So you don't need to be worried about the cost, the time, and even the outcomes. Okay, we can see the issue here actually. And last but not least, we go to self-care and feedback loops. So first is promoting self-care practices. So this one take care to routine medical procedures. This one, the chart will focus to about how understanding about the condition of patients, to see how make the better using routine, whether it's see it's comfortable or not. So this one will likely reduce costs mostly, and this will lower the complications as well. And last but not least is implementing feedback loops. This one can focus about patient satisfaction and outcome data actually. This one feedback loops. This means the like circle like the cycling. They can help to see either this condition or not actually, and this will help to enhance the quality of care and thus can bring the cost saving opportunities as well. So that's it for me. So I go to the my next group mate. Thank you.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Abdullah Binti Abdul Aziz with my SIG number 288726. In my part, I represent you guys about healthcare financing and social protection policies for citizens. Healthcare financing is very crucial for ensuring that healthcare services are accessible and affordable. So in Malaysia, the government funds healthcare mainly through taxations and subsidies, which focusing on universal health coverage (UHC) to reduce disparities in healthcare access. However, the rising cost of healthcare remains a challenge. Moving on to the next section is public healthcare financing. As I mentioned before, the public healthcare system in Malaysia is primarily funded by the government, which offering subsidized services at public hospitals and clinics. So these subsidies keep healthcare affordable for the population, ensuring that even the lower income groups can access necessary medical care. However, challenges such as overcrowding and rising healthcare costs continue to strain the system, requiring additional reforms to ensure sustainability. Next, I will be explaining about increasing healthcare expenditure in Malaysia. Healthcare expenditure in Malaysia is currently around 4% of GDP, which is below the global average. To meet the growing demand for healthcare services, it is essential to increase healthcare spending. So this will allow for improvements in hospitals like infrastructure, the equipment of more healthcare professionals, and even the upgrading of medical equipment to meet the increasing needs of the population. To overcome this, we need a resource allocation. A higher allocation of national budget funds to healthcare will help improve hospitals' capacity, staffing levels, and medical technology, which ensuring that the healthcare system can handle rising demands, reduce waiting times, and improve overall service delivery. Next outcomes is targeted investment in rural healthcare. Investment in healthcare for rural areas like Sabah and Sarawak is a priority. Many rural regions face limited access to medical facilities, so by building more rural clinics and introducing mobile health units, the government can ensure that healthcare reaches underserved populations, reducing health disparities. Last but not least is economic impact of healthcare investment. So investing in healthcare positive impacts the economy. So a healthier population leads to increased productivity, and healthcare investment can prevent families from falling into poverty due to high medical expenses. Every dollar, every ringgit invested in healthcare can yield up to $4 in economic returns.
Assalamualaikum and good day everyone. My name is Nur Shuhada binti Muhammad Rosli and my matrix number is 288021. Today, I'll be presenting on strategies for cost optimization and ensuring affordable healthcare solutions. Healthcare costs are rising globally, challenging governments, providers and individuals. This topic focuses on balancing financial constraints while maintaining quality and accessibility in healthcare. We will explore key strategies that can sustainably manage costs and improve equity in healthcare systems. Preventive care and early intervention are essential to reduce long-term healthcare costs. Screening, vaccinations, and wellness programs help detect and address health issues early, preventing the progression of chronic disease. For instance, lifestyle changes and regular health checkups significantly reduce risks of heart disease and diabetes. The data shows that 29.2% of Malaysians face hypertension and 15.6% have diabetes. By promoting healthy habits and conducting early screenings, we can prevent severe health outcomes and save healthcare costs. Optimizing healthcare workforce is crucial. Assigning tasks appropriately and providing ongoing training ensures that medical professionals operate at their full potential. For example, nurse practitioners can manage routine tasks, freeing doctors for complex cases. Cross-training staff increases flexibility, reduces costs, and improves patient safety. Programs like Malaysia's Public Service Department sponsorships are great examples of workforce development aimed at enhancing healthcare efficiency. Chronic disease management plays a pivotal role in reducing healthcare expenses. Diseases like heart conditions and diabetes are major cost drivers in Malaysia, consuming RM3.93 billion of healthcare costs in 2017 alone. Effective management includes patient education, medical adherence, and remote monitoring. For instance, digital tools can track patient health, enabling early interventions to prevent complications and reduce hospital admissions. Optimizing infrastructure can significantly cut costs while enhancing care. Hospitals can streamline workflows and upgrade to energy-efficient systems. For example, during Malaysia's 11th plan, hospital bed capacity increased by 3.3%, improving accessibility. Digital health systems and telemedicine further enhance efficiency by reducing redundancies and improving patient outcomes. Effective care coordination programs are essential for ensuring safe, seamless, and cost-effective healthcare delivery, especially for patients with chronic or complex conditions. These programs organize patient care activities and enhance communication among healthcare providers, preventing duplication of services and reducing costs. For instance, discharge planning protocols ensure patients receive follow-up care after leaving the hospital, minimizing readmissions. Similarly, coordinated care teams that include primary physicians, specialists, and dietitians can improve outcomes for chronic diseases like diabetes. By ensuring consistency and reducing care gaps, this program improves both quality and efficiency in healthcare delivery.
Hi, my name is Adam Hakimi bin Asmi. My registration number is 288188. So next, I'll be explaining about the innovative ways to cut healthcare costs. So let's start with the cool 3 ways to cut healthcare costs. So first is community health workers. Just think of them as the superhero is in undeserved areas. They may help patients understand their treatment, prevent illnesses, and manage chronic conditions by catching issues early. These workers can save money for everyone to improve health outcomes. Let's just say they're just bringing gaps, preventing illness, and saving costs. Next is the bundle of payments. This is like all-you-can-eat deal, but for healthcare. Instead of separating bills for every part of treatment, there's one price for everything. It encourages healthcare providers to be efficient, avoid unnecessary services, and make costs predictable for patients. So this is like one price for care equals to efficient and predictable. The third one is the lean management. Borrowed from industries like manufacturing, these approaches focus on outweighs whether it's reducing wait times or eliminating unnecessary steps. So what is the results? It's a faster, more affordable care for patients and fewer headaches and healthcare providers. So the other two is expanding primary care and public-private partnerships. So primary care is like the foundation of a house. It holds everything together. When people have easy access to primary care, they can manage their health early, reducing the need for expensive ER visits or specialists. It's all about prevention, and prevention always costs less than a cure. So, for public-private partnerships, imagine governments teaming up with private companies. Together, they can do amazing things: build a hospital, expand the telehealth, and fund community health programs. By working together, they make healthcare more efficient and accessible, even in rural areas where resources are really limited. So, a collaboration is equal to better healthcare for everyone. So, by combining prevention, smart payment models, teamwork, we can make healthcare be more affordable and better for everyone. That's all for me. Thank you.